Thank you guys. And so for everyone listening, we have a fireside chat for you today. We partnered up with Dr. Boham a few months ago, probably, to determine that we were going to offer the boot camp on a whole person care approach to breast wellness together. And through that process, found out that Dr. Boham had relaunched her book on the same topic with Amma, her daughter. And I thought we have to have the two of you come talk about the process of doing that. The boot camp is in many ways a deeper dive for clinicians who may read the book and want more tools and next steps from a little bit from what I understood. And so I wanted to just have the two of you talk about why you decided to relaunch this book together.
Thank you, Kate. Thank you so much for having us. It's really great to be with everyone. And it is so fun to have my daughter online too. It's like a joy. And then I'm like listening to her bio. I'm like, wow, that's so cool. She's so impressive. She came out of me.
That's what I was thinking during your bio.
You're so sweet. I was like, oh, my bio. Your bio is really cool. So Kate and Caitlin, thank you so much for having us. It's really a great pleasure to be with everyone and to be talking about breast health and wellness. And like what we were saying earlier today when we were chatting, and what we've always said is whatever we do to really focus on breast health and wellness really helps us focus on all over body health and wellness. And so there's so many tips that we're going to talk about today and in the bootcamp that can be usable for everyone in terms of helping them get to their optimal health and well-being. So really, it's so fun to be here. So how did we decide to do the book? A little background. It was 25 and a half, almost 26 years ago when I was in my residency training program and I was diagnosed with a triple negative breast cancer, and I was 30. I was 30 at the time. I had no family history of breast cancer, and I wasn't worried that I had breast cancer, but I was doing these breast self-exams because I was trying to figure out how to do breast exams on my patients. And so I was in residency, so I was like practicing on myself. And July of 1999, when I did my monthly breast exam, it felt fine to me. August of 1999, when I did my breast exam, there was a lump. And I was like, that's crazy. Why do I have this lump here? Again, I wasn't worried that I had breast cancer. I had no family history. I was 30. And even though we are unfortunately seeing breast cancer in younger and younger women today, back then, 30 was really young. There was a few other people who were 30 who went through treatment with me, but it was really quite young. And so I was like, okay, what's going on? And so I had just worked with a breast surgeon and she's, oh, you're thinking about getting pregnant. Let's just take it out because we don't really know what it is and it'll just be safer. And next thing we got me in quick and it was removed and it ended up being a triple negative aggressive breast cancer. And so I went through chemotherapy and radiation after the surgery. And when I went through chemotherapy, I lost my period, as many women do going through chemotherapy. And I was really worried that I wasn't going to be able to have children. Like that was a big worry of mine. I wanted to have kids and I wanted to be able to breastfeed. Those were like my two big focuses. A few months after I finished chemo and right after I finished radiation therapy, my period came back. And then the following month, I was pregnant with Amma. It was such a joy for me. Like it was like this, I will always say she's my miracle baby, as is my son, Tismark, too. But I really was so worried I wouldn't be able to have children. And it became this real important thing for me to be able to do. And I had children and then was able to breastfeed on the non-radiated breast. And then, of course, you're dealing with all of this crazy, why did this happen to me? And in 2004, I was lucky enough to be working at Canyon Ranch in Lenox, Massachusetts as a physician, where I met Mark Hyman and Kathy Swift and Cindy Geyer and Todd Lapine and many others who work in our practice at the UltraWellness Center now. And I went to my first AFMCP course. And actually, right now, I am in San Diego at the annual conference for IFM. So I missed the first session because we're doing this, but hi from San Diego. So I was at my AFMCP and I was blown away. I was like, this is so cool. This means so much to me. This helps. Functional medicine helped me better understand how all the systems in the body are interrelated and how we're all individuals. So I learned, okay, we have to think about medicine differently than how I was trained in medical school, right? I want to get to the underlying root cause, appreciate how we're all individuals. And it really started to make sense in my head okay, this is how I want to practice medicine. And I was blessed to be able to do that. And about 10 years ago, I came out with a DVD that sort of talked about my experience with how do you apply functional medicine to breast health and well-being. And the purpose was for the average person, not necessarily for the clinician, the average person. And it was a DVD. And so then I'm really answering your question a long-winded way.
I love it.
So then I realized about a year and a half ago, I was like, the references are outdated. Nobody has DVD players anymore. I've got to update this information. And my brilliant daughter is a great writer and a great editor. And so I came to Amma and I said, could you help me out with this? Could you help me bring the DVD into an ebook or paperback, back book if people want it? But I was like, how can we get this information to more people? How can we get it more out there? And because there's so much we can all do every day that influence our risk of breast cancer and keeps us healthy. Not that we can prevent all breast cancer, but there's a lot we can all do. And so I was like, let's try to bring this together. And I went to Amma and she said, okay, I will help you. That's my story.
It's a beautiful story. Amma, how was writing this book with your mom?
It was great. And thanks for having me as well. I really appreciate it. I've never actually done a webinar with my mom, something like this, but it's so fun. Yeah, it was a great experience. My mom, she is one of the most brilliant people I know. So being able to work with her and make this into a digestible format was also really important to me. I know, as you mentioned, like my background with holistic legal support, and as my mom was mentioning, doing this root cause perspective across different systems is really important to me, and making the information accessible. I've been so lucky to have it accessible since I was born, because my mom has just been telling me all of it, and I live my day to day. Oh, I need to work out today. Oh, I need to eat a vegetable, without really thinking about, oh, someone taught me this. And so it's really important to me to make that information accessible to as many people as possible. So it was a great experience.
I'm so glad the two of you have done this. So let's talk a little bit more about the book, and then we'll move into the boot camp, because they are a bit different. And Dr. Boham, you called this out, saying the book is written for the layperson audience, the non-clinician audience, and it goes through the things that are within your control and your power, the choices you make every single day. Optimize breast wellness, which is a term I think I first heard from you. And so talk to us about what's in the book in terms of the power we do have with the choices we make every day to help reduce our risk.
Yeah, Amma really helped me organize a lot of my thoughts. And like she mentioned, like trying to make it digestible for people. And it was great when we were writing it, because she would come to me and say, okay, this doesn't make sense. What are you trying to say here? And it's stuff that I do and say every day that you forget that it doesn't make sense to the person who's not a medical or trained in functional medicine. So it was very helpful in so many ways. First, I couldn't have written it because she's a very good writer, as I said, and just the way to organize it and make it, okay, people can understand, what do we mean when we say functional medicine? And what do we mean when we say we need to work to create a terrain in the body where cancer is less likely to grow? And so the keys of functional medicine is we are personalizing care. So everybody is different. If you took 10 women with breast cancer, there may be 10 different reasons for why they got that breast cancer, right? And of course, there's the triple negative breast cancers and the ER positive breast cancers and the HER2, right? So there's all sorts of different types of cancer. But what we're learning is that the terrain, the soil around the cancer cells, influence whether those cancer cells grow and can become invasive and even metastatic. So we do have some influence in terms of our risk for breast cancer and for a more aggressive form of breast cancer, potentially. So there are things we can do to create that healthy terrain in our body. And what I wanted to do within the ebook is really give people those tools. Okay, let's think for yourself. I'm a detective and I want to figure out, for me, what may be out of balance? What do I need to work on to help create more optimal health? We know, and we can delve into this more, we know we pay a lot of attention to things like insulin resistance and prediabetes as creating this inflammatory terrain where cancer is more likely to grow. And we also know that when inflammation is high in the body, cancer is more likely to grow, or if the microbiome is off, or you have excess toxins, or you're not exercising and you're not managing your stress. But what was helpful for me personally, when I was learning about functional medicine, I was like, okay, for me, I need to work on supporting detoxification, and I need to work on my stress management and how I giving myself more time to rest and recognize when my body needs more downtime. But I may have other patients, or for somebody else, it might be, okay, they need to get in more of those vegetables and they need to be exercising and lowering their percentage of body fat. So what we wanted to do with this book is give people the tools to say, okay, this is where I need to focus to create better breast wellness or breast health and decrease my risk of getting breast cancer, getting a reoccurrence, or helping survival with a current breast cancer. As I mentioned earlier, everything we do for breast health and wellness really does support all overall wellness.
Whole person health. Now, I heard it might have been you, Ama, mention exercise. And so we'll get into, Dr. Boham, you're talking about there's a personalized approach to this. And you can determine this person may need more vegetables or this person may need to focus on gut. And you go through how to assess this in your course that we're going to do in a few weeks with you. But I'm curious from the two of you, and Amma, given your background as an athlete, why is something like exercise important, especially someone who doesn't feel well, might not feel like they even have the energy to exercise? What's the evidence behind why we would want to incorporate something like exercise in a breast wellness program?
I was thinking about, even as my mom was talking before, is that a lot of the different systems that we talked about in the book, what's interesting and what was actually somewhat challenging about organizing it is that a lot of them feed into each other. So exercise can impact so many different parts of your system. I know for me, it's important for stress management. For some people, it might be to improve their insulin sensitivity. For other people, it might be to reduce their body fat percentage and help their ability to metabolize estrogen. That's what's interesting about the book is at times I was like, I think we're repeating this, but I think it's good. So, Mom, I'll pass it off to you to more of the details.
That was so good. We do talk a lot about just some of the basics of lifestyle that can have a big influence on risk of diseases. And sometimes I don't think we realize how little things make such a big difference in our overall health. And sometimes we just ignore our level of stress or our lack of exercise or the fact that we're just grabbing foods and not getting enough phytonutrients and vegetables. And so we really delve into that into the book, where just some of the basics of, okay, it's simple with exercise, 150 minutes of moderate exercise a week with 2 days of strength training. Sometimes the basics are all people need, and just get moving and work to increase lean muscle mass and release stress and get sweating. And exercise is so helpful in all the different systems in the body.
You both mentioned insulin sensitivity and insulin resistance. Why does that matter for breast wellness in particular? I think we're hearing a lot about insulin resistance in a number of chronic disorders, but when we're thinking about breast health and reducing our overall risk of developing breast cancer, why does something like insulin matter? And then Dr. Boham, let's talk about how you typically assess that in your clients.
Absolutely. So insulin is a really interesting hormone that influences so many aspects of diseases, right? So many different diseases in the body. So we know that, right, their blood sugar goes up after a meal, our body produces insulin, and insulin gets the food into the cells so it can be used to produce energy. And what we see is so common is insulin resistance. Unfortunately, we see lots of insulin resistance, both in the United States, but also worldwide. And what that means is the body is making more insulin to keep the blood sugar normal. And what we've learned is that high levels of insulin floating around in the body are one of those things that create an unhealthy terrain that causes cancer to grow. So high levels of insulin have been associated with multiple different types of cancer: head and neck, lung, colorectal cancer, but definitely breast cancer. And so what we really wanted to focus on is what can every individual person do to improve their insulin sensitivity. And we know that exercise and building lean muscle mass and making better food choices that don't spike blood sugar all help improve insulin sensitivity. And then in the boot camp, what you were mentioning, like that's where we dive into, okay, you are a clinician and somebody comes into you who's concerned about their risk of breast cancer, or maybe they have active breast cancer, or maybe they just got through treatment, all of those scenarios, what can you do as a clinician to help empower your patient? Because they feel very motivated at this time. Honestly, there's so much we're learning. Like, I don't want anybody to feel blamed like they did something wrong. Right. But there are things that we can do that can improve our risk in the future. And so as a clinician, you want to be like, okay, what are the tools? What are those basic tools that I can have so I can feel comfortable when somebody comes in to see me to say, okay, I'm going to help this person decrease their risk, and they feel motivated. So we know with insulin, high levels of insulin have been associated with, because it's a growth hormone, right? Insulin is a growth hormone. Chances of even getting cancer, as I said, multiple different kinds, including breast cancer. High levels of insulin have been associated with decreased survival from breast cancer, and high levels of insulin have been associated with increased metastases, so that breast cancer is spreading. Again, high levels of insulin have been associated with creating a terrain where cancer is more likely to grow, right? So whatever we can do to prevent these spikes in insulin after a meal, or just having too much insulin floating around, is really critical. There's lots of ways we can assess somebody's level of insulin resistance. And that's one of the things I really will delve into in the boot camp. But I'll do a fasting insulin, for example. Everybody can have their doctor run a fasting insulin. And you would do it first thing in the morning after not eating for 8 to 12 hours at least, and see where your level of insulin first thing in the morning. And the research has said really greater than 10 is a concern for insulin resistance. We like to see it around 5 or 6. And so that's a typical level of fasting insulin I like to see. We have to be careful is that just one biomarker. And so often, sometimes one biomarker is a great monitor for one person, but somebody else, it's not as a perfect biomarker. So we do look for other signs of insulin resistance, everything from measuring somebody's level of lean muscle mass, percentage of body fat, how much visceral adiposity somebody has. So we look at waist to hip ratio. You can get some signs of insulin resistance on somebody's cholesterol profile. So if their triglycerides are high and their good cholesterol is low, or they have too many LDL particles. So there's a lot of ways we can assess levels of insulin resistance.
It's brilliant. I know part of what drives you both is, and why you wrote the book in many ways, is to make this information really accessible. And so I'm curious from the two of you, when we think about reducing insulin resistance, it doesn't have to come in a pill or a prescription per se. There's some really healthy lifestyle things you can do. So I'm curious from the two of you, what are some of your favorite ways to teach people that might even be free about how to optimize their insulin sensitivity? And I'm thinking exercise is one of them. You mentioned that you go for a walk or you make sure you exercise every day. What are your favorite free tools to help with that?
Yeah, I would say that exercise is a big one. And just in general, I think what's great about the book and about taking lifestyle choices to improve your breast wellness and overall wellness is a lot of it is free or relatively cheap. Like, I think something when I was much younger that really changed my brain was when I watched this documentary with my mom that talked about how if you measure food in terms of the dollars per calorie, then maybe like fast food is cheaper. But if you do it dollars per nutrient, so maybe nutrients like we talk about in the book that improve insulin sensitivity or gut health, or just in general, there are certain great nutrients that I'm sure I could talk a little bit more about that directly are connected with reducing your risk of cancer. And I think when we talk about like free and cheap, I think those are things that I think about often. And then even things like stress management, sleep is a big one that I can think of that I definitely struggle with. But yeah, those are some that I think of, like meditation. Those are free, cheap options. Yeah.
Great suggestions. We know that every time you exercise, your insulin sensitivity improves for the next 24 hours. And that makes sense, right? Your body's trying to get the food that it needs for energy into the cells. So every time somebody exercises for 24 hours, their insulin works better. Their body doesn't need to make as much for the same effect to happen in the body. And so that's why we keep going back to the exercise piece and like you were mentioning, sometimes people, if they're in the middle of treatment or whatever, they're feeling a little bit crummy and they feel like, oh, maybe I just need to rest. But there's been research to show that even light exercise, getting outside, going for a walk, getting into nature, walking after you eat a meal, all those things improve insulin sensitivity and help create that terrain. And our circadian balance is really critical. We do know that if you ate the same meal at 9 p.m. as you eat at noon, your body would produce a lot more insulin if you eat that meal at 9 p.m. And so one of the things that everybody's been focusing on, which I think has been great, is working to help people not snack after dinner. So it used to be this very common thing, like we'd eat dinner and then we'd get snacks and snacks. And we know all of those, that late night eating create higher amounts of insulin response in the body. And as I said, if you ate it at noon, your body wouldn't make as much insulin as it does at night, because what it's doing is it's storing that food because, you're going to go hibernate or sleep. Just as all the research is showing, giving your body not eating after dinner, giving your body those 12 hours at least of not eating at night can decrease risk of breast cancer. And it also really helps with resetting the microbiome. And so I think those are great things to really focus on. And then from a food perspective, my favorite way to work people, the simplest way when you are saying, okay, I want to improve my insulin sensitivity, balance my blood sugar, prevent these spikes in blood sugar and insulin, is at every meal, I want to have a good source of protein, some healthy fats, and a lot of fiber coming from your vegetables or ground flaxseed or beans and legumes or a whole grain like quinoa, right? So you want to have a good source of protein, healthy fats, and fiber at every meal, because then you won't get these spikes in blood sugar and then spikes in insulin. And we know those spikes in blood sugar and insulin are lead to insulin resistance and prediabetes. And that's a really great thing that everybody can do. In addition to just pulling away any sugary drinks, refined carbohydrates, and really focus, as Amma was mentioning, on the nutrient density of food. Because we know that when foods are more nutrient dense, all the cells in the body work better. So we need all of these vitamins and minerals and phytonutrients coming from whole foods to help all of our cells in our body work better on a cellular level. You were mentioning chromium, magnesium, all of these nutrients that come when you eat whole foods versus refined and processed foods help all our cells work better and help decrease somebody's risk of insulin resistance and prediabetes. Just pulling away the junk foods, the refined and processed foods, replacing them with more whole foods, more fiber, and balancing blood sugar, I think is really critically important.
This is such a useful conversation, and I can see little hints of this thought in some of the questions in the chat. And so I actually want to just ask this directly. Someone may be listening to this who's going through treatment, and who's already been diagnosed, and who's thinking, oh my gosh, I wish I would have known all this before. Does this even apply to me anymore? If I'm already diagnosed, does this information even apply to me? Is it safe for me? How do I even talk to my doctor about this? Can we speak to those people who are in that spot?
100%. We know that creating that terrain where our insulin levels are lower, our blood sugar is lower, helps our immune system work better. So we know that when people are working to balance blood sugar during cancer treatment, that their outcomes are better. So much so that oncologists have used metformin in the past, or will use metformin in some situations, which is an insulin sensitizer. Again, like you said, Kate, we don't need to necessarily go to medication here. It just highlights the fact that we know through science, right? We know that cancer grows when insulin levels are high and blood sugar is high. So even if you're currently going through treatment, we absolutely know that balancing blood sugar and preventing those spikes in blood sugar and insulin can help improve your outcome 100%. In fact, Walter Longo has done a lot of research in this area, so has many other people, in working on what's called the fasting mimicking diet, which is a diet that people use if they're doing chemotherapy. It's sandwiched around their chemotherapy for those 5 days, 2 days before, day of, and 2 days after, where you lower the calories enough in your diet so your body goes into ketosis. And what that means is when your body goes into ketosis is it's using your fat, whether it's your own body fat or fat from the food you're eating, for energy, and not using carbohydrates because you don't have enough around. And we know actually through research that it actually improves survival. It helps people have less side effects during treatment. It helps them have better outcomes from when they're using this in addition to the treatment that they're going through. And I'm definitely going to talk about this during the boot camp because I think it's really important area for us to know about. And it's very important for clinicians to know how to implement that with their patients. For the average person out there, I will often recommend you want to pair up with a nutritionist or a nutrition professional who has that knowledge on how to implement something like the fasting mimicking diet during your treatment. Because sometimes oncologists worry, oh, we don't want this person to lose too much weight. And what if they get too weak? But for most people, they've shown that they are able to maintain a healthy weight and they actually have less side effects from the treatment and they have better survival. So I would definitely recommend looking into it and pairing with somebody who knows how to help you implement it in a safe way.
That's beautiful. One of the things that you have both also mentioned is gut health. And so throughout this, I've heard about eating high fiber foods, but for the person who doesn't understand, why would I be focusing on gut health? If I'm someone who's worried about breast wellness, what is the connection between gut health, breast wellness, and everything I might be doing to either optimize my breast health, or if I'm already diagnosed or have just finished treatment, to really optimize my chances for having healthy breast tissue health going forward? How is the gut related to that?
It's just crazy how we're learning so much about our microbiome, those trillions of bacteria and other bugs that are lining our intestines, but also our skin. But what we learned is we have a microbiome in our breast tissue, which is fascinating. And research has shown that when people have breast cancer, their microbiome is different in their breast tissue than when they're removing breast tissue for, let's say, a breast reduction surgery. The balance of microbes are completely different, which is totally fascinating. And we're also learning that the level of diversity in your gut microbiome impacts your breast health. And it's just a fascinating area that I found so interesting because unfortunately I was on tons of antibiotics as a kid. So I had chronic urinary tract infections from like the age of 5 to 16, I would say, maybe even a little bit longer. So I was on treatment doses of antibiotics again and again and again. And there's been so much research showing the connection between high levels of antibiotic use and risk of cancer. So definitely this association with colorectal cancer, that makes sense. But there's also an association with breast cancer. And so I found that so fascinating. And it was an area, big integrative physician who spoke to me soon after treatment. He said to me, you got to focus on your microbiome. And the more and more you learn, you're like, yes, he was absolutely right. And there's so many reasons for that, right? We're learning that the microbes in our gut influence inflammation in the body, right? So they influence whether that terrain is more likely to allow cancer to grow. We also know that the microbes in the gut produce these things called postbiotics. These are these components from the probiotics that influence inflammation in the body, influence insulin resistance, influence how you get rid of estrogens after they've done their job in your body, how you get rid of toxins. And of course, we know things like if you're not having regular bowel movements, that's going to allow toxins to get reabsorbed into the body. So there's so many connections between the gut microbiome and breast health. And there are tests that I do every day in my practice that help me assess how is their level of diversity? How does their microbiome look? Is it healthy or is there dysbiosis? Or what can I do to improve this? Or is there some markers that makes me say I've got to do some things to change and shift somebody's microbiome or help them add in something like calcium D-glucarate to help eliminate unwanted estrogens and toxins. So the connection's fascinating.
It is. I'm glad we have a whole week for it. Yes. In the boot camp. That's going to be really helpful. We have a question here basically asking, how can you test your microbiome? And so, Dr. Boham, you alluded to this. When you're saying I test for it in my practice, it's a stool test, right? That's what you're using. Can you explain for somebody in the audience who may not know what stool tests are, how many options there are on the market for them, and what you're looking for in a stool test? You mentioned it briefly, but I just want to specifically answer this question for someone who may be feeling like, I went to my gastroenterologist once after food poisoning and they did a stool test, but they didn't tell me anything about what you're talking about. What types of tests are you using to assess the microbiome?
Yeah, so there are some specialty stool tests that just assess the microbiome further. And a comprehensive stool analysis will look at many things from the levels of good bacteria and to markers of inflammation, to how are you digesting and absorbing? Are there any infections? Are there parasites? Is there yeast overgrowth? Is there bacterial overgrowth? And then it will measure something called beta-glucuronidase. And beta-glucuronidase, so this is in the stool. We know that this enzyme, beta-glucuronidase, when it is high, what ends up happening is estrogen that's bound to glucuronic acid, which is a way that after the estrogen, it's done its job in your body, it is packaged with something called glucuronic acid, and then you eliminate it in your stool. But if somebody has a high level of beta-glucuronidase, which you can test on these comprehensive stool analyses, is that will then cleave that estrogen-glucuronic acid combination, allowing the estrogen to get reabsorbed into the body. So there's been a lot of research in that area, and they're also looking at that might be influencing toxin reabsorption too. So not just estrogen after it's done its job, some of the xenoestrogens or other toxins. Like there is something as a supplement we may use like calcium D-glucarate to bind to those toxins and estrogens to help the body eliminate it if we see high beta-glucuronidase. There's also some new testing, which is really exciting. It's also stool testing. It's called whole genome shotgun sequencing. It's fascinating new testing with they look at your stool sample, right? And then look at all the different DNA in the stool sample and match it up with this database where you can say, okay, do you have certain types of bugs in your gut that are more likely to produce more beta-glucuronidase and therefore decrease your ability to eliminate estrogens after they've been used and toxins after they've been used? So that's also a really interesting additional stool test that conventional GI docs or conventional docs aren't doing these stool tests. They're doing more just looking for, is there infection? Is there maybe, is there sign of inflammation doing a calprotectin? But these are more advanced testing that can give us some really fascinating information.
And I would imagine it lets you then say, hey, rather than take a probiotic, take this probiotic because of these 5 reasons. It lets you really hone in on what specific probiotics or postbiotics might this person need at this time in their life that helps you personalize it. And you're nodding.
Absolutely. I think this is an area we need more and more research, but I think that's the hope is right that we will be able to personalize not only probiotics, but like the specific prebiotics that feed the probiotics that this person needs, or maybe a specific postbiotic, or it's a sign to me when beta-glucuronidase is high, it's a sign to me that there is some dysbiosis that I need to be dealing with. And so I really want to get that information from the patient of, okay, what is their gut health like? Are they bloated after they eat? How are their bowel movements? How often are they having a bowel movement? Do they digest their food well? What can we do to shift dysbiosis? Often using that 5R program, right, from IFM. So
one of the things that I heard Amma mention earlier was 2 of the things, stress, and we've alluded to this, a little bit of the exposures we're encountering in the environment. I want to talk about stress for a minute because one of your lifestyle pillars in the book is stress management. What is the biochemical reason someone should care about their stress when they're undergoing treatments? And then what are some of the free ways that you guys talk about in the book to manage stress?
There's a myriad of reasons why high levels of unremitting stress. So it's not just any stress. It's like having regular chronic stress without having the tools to mitigate that, right? Why that impacts somebody's terrain. Let's go back to the terrain, which influences cancer growth. So first, we know that high levels of cortisol are associated with high levels of insulin resistance and high levels of insulin production and worse blood sugar. I think one of the things that I find so fascinating when people have been doing these continuous glucose monitors is people have learned, okay, that was a bad meal. I just had oatmeal and berries. And I thought, oh, that's so healthy. But then my blood sugar spiked afterwards, right? So I think it helps, or that acai bowl, right? That you think, oh, that's so healthy. But then I have this huge blood sugar spike afterwards. So I think the continuous glucose monitors have been really helpful for that. But what I find so fascinating is patients saying to me, I had no idea how much stress was impacting my blood sugar. And I think that's just so critical to recognize. It makes sense, right? If you are running away from the tiger, what does the body do? It sends glucose into the blood, so you have the energy to run away from the tiger. So that chronic level of stress is creating high levels of blood sugar, which we know is pro-inflammatory, just like high levels of insulin is. And so I think that's a big major reason. In addition, we do know that it impacts the functioning of the immune system, everything from the innate or adaptive immune system, things like natural killer cell activity, The natural killer cells are these cells in the body that go around and find abnormal cells and gobble them up. And so we know that when we're in these states of chronic, unremitting stress, that is impacting all functions of the immune system as well. And there's been so much research on stress and how it changes the microbiome. And so that's fascinating.
I just want to say it's nice to know that there are things you can do as well, and that if you know you're having stress and you know this may be going on, there are tools that Alma's going to talk about that you can implement, because I can imagine, especially the people who are watching who may have a diagnosis, thinking, oh my gosh, are you telling me now that I'm stressed? I'm making this worse. But now I'm stressed and I can't stop being stressed. Now worried I'm making myself worse, which is stressing me more. It sounds like there's interventions that we know can help. So even if the stress in your life is still there and it's unchanged, there are things you can do to change how that shows up in your body to reduce the harmful impact it has on you. And so, Alma, you had unmuted to talk a little bit about those things. What are some of your favorites?
Yeah, and I think actually what I was going to say really ties well into what you just mentioned. So thank you. There's actually some really cool research that having control or having a sense of control over the stressful circumstance actually improves your ability to, your immune ability, your ability to fight a tumor, even more so than someone who was never exposed to, or than a rat in this scenario, who was never exposed to the stressor in the first place. And I think that's something that's great about this information, is like having access to it can really improve whether or not the stressor is still there. If you have the diagnosis, it might still be there, but having access to feeling a sense of control over the situation, or at least just a little bit of, let me just go for a walk today, let me just make sure to have my green tea today, can be something really great. I know along those lines that something that my mom always mentions was really helpful for her during her treatment is a gratitude practice. And you want to talk more about that, but that can be really useful for stress. And then there's also, of course, we mentioned meditation is something that can be really useful for people. Breath work, yes, you came up with the word, but breath work, yoga can be really good for people, and also a form of like exercise. So
it's beautiful how just reframing it to, okay, there might be stress, but I'm doing the following things today to help my body deal with the stress and to buffer the stress can actually be medicine in itself. That mindset shift of I'm doing something about it is in itself healing, is really beautiful. You had mentioned your mom might want to talk about, was it breath work or
gratitude?
I think you guys really just hit on some things that are so important. Like you said, we don't want people to feel nervous about having stress, or right? I think that all stress is not bad, but it's just recognizing, okay, I want to implement some things to help give my body some time to calm down and to rest, to help improve the functioning of my immune system. And that research that Amma was mentioning is so critical, because it was this one that we always highlight was done with rats, as she said, but they found that when the rats were not stressed, their immune system was not as good as the rats that were stressed, but had this lever to stop the stress, which is fascinating. So it's not like we have to get rid of all the stress, but we want to be doing these daily, regular things, even though they're hard to do. For me, that's the hardest part. Like when you talk about those personalized lifestyle factors in functional medicine, I was a nutritionist before I went to medical school. I was an exercise physiologist. I was sleeping. Actually, I was working in the ICU, so maybe my sleep wasn't so great. All about prevention. I thought I was going to prevent everything. I didn't really recognize how much stress was impacting my health, but also just my quality of life. Not that I'm grateful that I had breast cancer, though maybe sometimes I am, because it really created this whole path in my life, which has been really fulfilling and wonderful. But it really helped me recognize, okay, you've got to change the way you're doing things. It was the motivator for me to say, I have got to try to work to do less and take more time to rest and listen to my body and not just push through, and do some breath work and get out in nature and try to be paying attention to when my body was not in good balance. I loved gratitude. My gratitude journal, I always say, really saved my life during cancer treatment. It just helped me change my outlook on the whole thing. And I just wrote down 3 things every day that I was grateful for. And it was really hard at first. I was pissed off. I was 30. I was like, why would this happen to me? I was all about prevention. And I was mad. I was angry. I was sad. Writing down things I was grateful for was not easy. And I just kept doing it. And over time, I started to notice that walking around during the day, I could feel more gratitude on a moment-to-moment basis, just naturally. I'm sure it changed my terrain and my overall health, but probably the best part about it is it just changed my quality of life and helped me just enjoy day-to-day life more. And so I think it's a great tool, as is things like acupuncture. I find when my body's really stressed, and I have a COMT homozygous variant, which we do talk about in the boot camp. So I definitely have a hard time breaking down adrenaline. And when my body is like overstressed and stuff, it's very hard for me to sit and do breath work. But like things like acupuncture or Reiki, hands-on approaches, body work really just help my body calm down.
I love that there's this healing power in taking steps to counter the stress. You deal with people in your life who have a lot of stress, and it's not in a medical setting, but it is in a life setting. And I'm curious, are there methods that you find help people make sure they get these practices in, or even do something every day to help with their stress, like whether it's writing a list or checking things off? And you yourself were a very busy student. Now, you're working. Do you have some tips for someone who might feel overwhelmed by the amount of things they have to do per day, and now they're thinking, I do really want to breathe and write my gratitude list, but I don't even know like how I would fit that in?
Yeah. And as my mom mentioned, I think my mom and I are very similar. So this is definitely probably one of the hardest things for me as well. And so I think I really appreciated how you said, knowing that you're stressed, not taking that on. And I think my mom also mentioned like these things can happen and they might not be your fault. I think that's a really big thing for me and for the young people that I work with. There's a lot of different things that can happen throughout your life that could be due to your genetics or how you grew up. So that can be helpful for my clients, like coming to terms with the things that they're dealing with. And I would also say in terms of like having time, I think whenever I fall away from a lot of those practices, the easiest thing to do is, like we mentioned, like a gratitude practice at night. It takes just a couple of minutes to write down each thing. It feels really good. Or first thing in the morning, not checking your phone, doing some deep breaths, setting an intention for the day. If you can create space between work and your home life, but even then, like sitting down for 5 minutes and just doing deep breaths can feel, or even if 1 minute feels more approachable, sometimes I'll sit down for 1 minute and I'll end up sitting there for 20. So I think those are like tips that usually work for me.
Those are awesome. Reducing stress is so important. And I think Dr. Boham used to do such a good idea of explaining why stress impacts other systems of the body. One of the ways that I also know stress impacts us is through almost inhibiting our ability to detox. If we're not sleeping well, most of our detox happens at night. We have a whole week in the boot camp, and you have a whole section in your book about endocrine disrupting chemicals and environmental exposures. And the reason I think ending with this is beautiful is because we're talking about control and things you can do. And part of the things that we can all do is to limit exposure to some of the things that may just confuse our body about the state of our hormones, or may just add a bigger burden to the things we need to detox. So can we, high level, talk about why do we need to consider environmental exposure in breast wellness? Then let's dive a little deeper towards the end about what sorts of things you'll be teaching clinicians about how to assess for environmental exposures and help their clients deal with them.
This is such a big topic. And honestly, I would say the area I focus the most as a clinician with my patients, especially young women, but really when you get a diagnosis of cancer, I think toxin exposure and detoxification is probably, for most people, the area we have to focus the most. And unfortunately, so toxins in the environment are carcinogenic. They can cause cancer to form. There's a whole line of toxins we pay attention to, those xenoestrogens. They're things like parabens and phthalates and pesticides and herbicides and things that can impact the estrogen receptor. With that whole thing of it's not your fault, we also know through research that sometimes those exposures happen really early in life or in puberty or as a fetus that impact the type of breast tissue you have and how prone you are to a cancer growing. But there are things, what I work on with everybody is lowering our toxic load, because our body has this tremendous ability to detoxify. We have all these systems in place, from sweating to pooping to peeing to our liver to our breath, that help our body get rid of toxins that we're exposed to. So we work to lower our exposure, but also support the body's natural detoxification capacity. And testing in this area is fascinating. It's, again, something I'm always doing, as a clinic, we do a lot of different split samples on different companies out there, and we're always looking for better and different tests for all sorts of things. But toxins is an area, it's complicated, right? But we'll do urine testing for toxin levels, though that will tell us about recent exposure, and blood testing for heavy metals you can do, again, telling us about recent exposure. Sometimes we try to get a sense of past exposure through some different biomarkers of oxidative stress, GGT levels. These are all things we'll delve into, as well as your genetics and some genetic SNPs that make it harder for you to produce glutathione and detoxify toxins. So you know how there's no perfect test for anything, but this is an area I think as a clinician, we have to look at the whole picture, which of course we always want to do, but you have to look at it from many different angles to try to get a sense of where do you need to work with this patient to help support their body's detoxification capacity and lower their toxin exposure.
It's brilliant. I'm particularly excited for that week because I think a lot of clinicians know they hear in the media they should have their clients avoid the dirty dozen and maybe not use so many harsh cleaners and opt for something more natural. Maybe they look for makeup or healthcare or care products that don't have specific ingredients in them. But in terms of assessing your own exposure by looking at biomarkers like urine or blood, it's not commonly taught in school. And so I appreciate that you have an entire week dedicated to this. I know we're at time. I want to give the two of you a chance. You've gotten a lot of love in the chat. I tried to answer some questions by grouping them into themes. For the clinicians listening, you can get so much more, 6 whole weeks with Dr. Boham by joining the boot camp. Caitlin has the link in the chat. Tell us, what do you want to make sure people take away from today, and where can people find more about you and the book?
So obviously, while I'll be doing that boot camp, as you mentioned, the book is available on Amazon. I think someone put it in the chat as an ebook or a physical book.
It's really great to be with everyone, and of course, Kate, but also Amma, to do this together. It's really just such a joy that we've come like full circle in this. For me, it was just an amazing experience. I guess what I want to just give people and hope they get away from today is, for individuals, there's things you can do every day that influence your risk of multiple different diseases. And again, it's personalized, and we can't each do everything all the time, right? We want to figure out for us, where do we need to focus to improve our optimal health? And I'm excited to be doing this boot camp with Rupa University. It's really a pleasure because I want to give the information to other clinicians so that they feel comfortable, because so often clinicians get scared, understandably, like they feel like, oh no, I don't want to step on the oncologist's toes, or is this okay to do now, like you were asking, or what kind of tests can I do, or I don't want people to feel blamed. Like all of those things I think are really good things that we need to delve into as clinicians and help them have the tools to feel very comfortable with patients who are going through active cancer treatment, or who have had cancer, or who just want to prevent it. And so that they can have some tools to help them feel empowered and motivated and to have some hope.
Welcome to Rupa Health, the best place to order, manage, and track results from over 30 different lab companies in one single place for free. It's going to take you under 2 minutes to sign up, and you can order any functional medicine lab for your client in under 30 seconds. Let me show you how it's done. So here's our beautiful interface. I'm typing in the name of my client, selecting the lab that I want to order for them, and hitting send. From there, Rupa and their amazing team handle the rest. They email the client, collect payment, and even offer an interest-free 3-month payment plan. We've also built the world's largest library of information about chronic health conditions, the lab tests that can help you find the root cause, and the evidence-based interventions that you can use to help people heal from them. It's called the Rupa Health Magazine. There, we have in-depth articles about almost any health condition you can imagine. And we give you step-by-step protocols that other clinicians have used to help their clients heal and that are verified by evidence-based sources. You should totally check it out, and it'll transform your practice. And we can't wait to see you. So make sure you sign up today at rupahealth.com.